Welcome back to the deep dive. Today, we're taking a plunge into something really shaping healthcare right now, co-design. Now, maybe you haven't bumped into that exact term, but you've likely heard related ideas, things like co-creation.
Or experience-based co-design.
Yeah, that one too. Or even public and patient involvement.
Right.
Fundamentally, co-design, it's about designing services with the people actually using them, not just designing for them from afar. It sounds incredibly positive, doesn't it?
It absolutely is, in principle. A great idea.
But sometimes, even the best intentions, they can lead to, well, unexpected places.
Mm-hmm.
Think about like a new app feature. It's meant to make things simpler, but whoops, it actually adds a whole new layer of confusion for some users.
That's a good way to put it. Because these approaches, co-design and the others,
Yeah.
they're not just buzzwords, are they?
No, seems more significant.
Exactly. They're part of a real cultural shift in healthcare. A
Right.
kind of zeitgeist, you could say.
A zeitgeist. I like
Yeah.
that.
Yeah, this real push towards genuinely involving everyone, patients, public, staff, in shaping how health services work. It's powerful, it's popular, and it's definitely gaining traction globally.
Okay, so given it's so widespread, this adoption,
Hmm.
our deep dive today, it focuses on a really insightful piece.
Oh,
It's an excerpt from a paper called Mitigating Unintended Consequences of Co-Design in Healthcare.
unintended consequences. That's key.
Right. It's by Ní Shé, published in Health Expectations back in 2021. And it doesn't just, praise co-design, it asks that crucial question.
What happens when things don't quite go according to plan?
Exactly that.
And focusing on those unintended consequences, well, that's precisely why this paper is so important to look at.
Right.
Because while co-design and co-creation, all that, while they're really beneficial in theory, making them work effectively in the real world,
It requires more.
it requires us to understand the potential pitfalls, the challenges. It's not just about cheering for the idea, it's about anticipating what could go sideways.
And crucially, how to maybe stop that from happening.
Kind of proactively address it, yes.
Okay, so what are some of these potential downsides then? These unintended consequences that Ní Shé talks about. What should you, listening, be aware of when you hear about co-design projects?
Well, the paper points out a few key areas. One pretty significant risk is tokenism.
Tokenism, okay.
This is where participants are, yes, they're involved, but their input, their contributions, they aren't genuinely used or really valued in the end.
Ah, I see. So it's like feeling you're just there to tick a box.
Precisely. Not to actually influence the decisions being made. And that can obviously lead to frustration, right? A feeling of being disempowered even.
That makes total sense. You invite people in, but if you don't actually listen or act on what they say, yeah, it could be worse than not asking them at all. What else? What other risks are mentioned?
Another really important one is power imbalances.
Okay. How so?
Well, even though the goal is equality, bringing everyone together,
Yeah.
existing hierarchies, the sort of built-in structures within healthcare, they can still unintentionally overshadow patient voices.
So like professionals might dominate the conversation without meaning to.
Exactly.
Yeah.
Or maybe the process itself doesn't properly support people who aren't as confident speaking up, especially in more formal settings.
That's a subtle but really critical point. Just having people in the room doesn't magically make everyone equal or equally heard.
Not automatically, no.
Are there other big consequences highlighted in the paper?
Yes, absolutely. The paper also brings up the potential for emotional burden on the participants.
Emotional burden.
Think about it. Patients, caregivers,
Mm.
they're often asked to share really personal, sometimes quite traumatic experiences to help inform the design process.
Yeah, that takes a lot.
It really does. And if there isn't good emotional support actually built into that co-design process, well, sharing those stories can end up being distressing, maybe even feel exploitative rather than empowering like it's meant to be.
Wow. That's incredibly important to consider. So, wrapping this up a bit, the core message from this deep dive seems to be, yes, co-design, co-creation, all these collaborative approaches are a huge vital trend in healthcare.
Definitely.
But the real value, maybe the deeper insight, isn't just adopting them. It's about actively understanding and planning for these specific unintended consequences.
Mitigating them, yeah.
Being ready for the complexities involved.
Precisely.
Yeah.
To truly get a handle on any widely used method or popular idea, whatever it is, it's just essential to look beyond the shiny surface, beyond the benefits everyone talks about.
And examine the potential drawbacks, too.
Yes, See the whole picture? That gives you a much more balanced, critical, and ultimately a more effective perspective. It helps to make sure the good intent of something like co-design actually translates into real positive impact on the ground.
Makes sense. So here's a final thought for you to maybe chew on. How might recognizing this potential for unintended consequences, how might that change the way you approach any widely praised concept in any field? Does it encourage you to look a bit deeper than just the surface claims? Something to think about. Thanks for diving deep with us today.